Whoa, 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 yeah, we are bringing the taste of yeah, 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 yeah,
Good morning, everybody. It's Positive Tuesday today. Well, Tuesday, November 17th, 2020. Spooner Health CEO Mike Schafer will be joining us later on in the show for a chat. Pretty much all things COVID-19 and the impacts that it's having. Hope everyone had a great weekend and you're off to a great morning and a good start to the week. For Barron County Sheriff Chris Fitzgerald, I'm Ben Dryden, and you're watching Positive Tuesday with Ben and Fitzy, presented by, wait for it, ICAA. This week's ICAA program spotlight features WI Prevail, ICAA's Youth Development and Prevention Services program, which uses a global approach that helps support youth and positively impact their environment. Partnering with communities, families, and youth, their youth development and prevention program focuses on substance abuse, mental health awareness, youth development. For more information, check them out on actually they have a specific Facebook page just for this. Just search WI Prevail in Facebook and check them out. Fitzy, good morning. And actually, before anything, I want to ask you a quick question, buddy.
Okay.
What can I do to make your day a better day?
You know what? Just doing this show every day, and we give people a little bit of a smile on their face and get them through another day ahead, and that's what it's all about. And I don't need anything, Ben. It's just I love doing the show with you, and I love the people that are joining us and watching, and we just want to let's go make a difference. That's what we do.
Well, we try to.
Yeah, we can only do so much.
Yeah. So obviously, we always set the show by talking about things that have gone on for each of us, either personally, professionally, in the last week. I actually wanted to start, if that's all right, because it's all about me.
I get it. Your show.
Yeah. No, it's not. Oh, sorry. And I just saw. Good morning, Jamie. So last Thursday I had Tom Tiffany on. That was nice to chat with him. I played some games like F1 racing at the steering wheel and everything. Mm-hmm. But I actually had a couple of great positive feedbacks I wanted to share, because you and I have talked before how words matter, dude. And if they're negative words, it just sucks your energy. But just saying simple things about someone or to someone, man, that just fills their cup, right? It just brings so much more positive energy to you and your day and your week, and just little things like that are huge. So, where to go? All right, so this one was from, and I put this on our Facebook page, I think, last week. This is from a Garrett Larson, and this was via email. He said, I just wanted to let you know that you do a fantastic job. DrydenWire is my news source. I look forward to watching Positive Tuesday with Ben and Fitzy. Fitzy does an awesome job. He does so much for Barron County and truly cares. He is so involved with so many things, it's almost hard to believe. Thanks, Ben, for such a neutral point of view on everything. Keep up the great work. I'll continue to watch and spread the word. What? I mean, that just made my day when I got that.
No relation. I don't have a fake Facebook account. That's a real person, I assume. And maybe we'll have to get T-shirts. Maybe people will buy a DrydenWire, Ben and Fitzy shirts.
Ooh.
Yeah.
Nice. Yeah, totally down. Hold on. Where's my pen? I gotta write that down so I don't forget. Shirts.
But that's what we never started this show with any purpose, really, Ben. As you know, we just started.
Actually, somebody asked me the other day, how did this come to be? And I'm like, I kind of don't remember. I think it was during the Safer at Home, and I was like doing shows every day because there was nothing else to report on. And you and I started doing these shows, and I think you were the one who kind of coined it and said, yeah, it's Positive Tuesday.
Yeah.
And it just kind of developed from there.
Yeah, and that's all it is. I mean, it's about getting out there in front of this and being transparent on a lot of issues, and we'll talk about some of the press releases that we've sent out this week. But it's kind of evolved into just doing what we can do to make somebody smile. And like you said, we've kind of coined the phrase "words matter," and we saw some of that through some of the hate through the election and some of the other issues that we've seen across the country and locally here. And words matter, and we need to do some things to support each other. I've felt the love, from a law enforcement standpoint during certain cases and incidents we've had here in Barron County, and I just want to pass that good feeling off to other people, because I've got a great idea, and I'm going to ask Mike when he comes on what people can do for his staff, because I know what people did for our staff during the Kloss case, and I think that's what's going to be really cool. And there's some things that we all got to take some time and do a few things here to get us through the end of the year here, and I think we can do it. But it just takes some positive vibes and some of us coming together and doing some great things.
And I also had another thing, a positive thing that was sent to me. And again, this stuff just is big. So as I mentioned at the beginning, I had Congressman Tom Tiffany on. We do once a month. He comes on. I think it's now the second Thursday of every month. He comes on. We just do, I don't know, just a chat. Let us know everything that he's up to. So that was on Thursday, and then on Monday morning, yesterday morning, like at 6:30 in the morning, he sends this text message. And Tom, first of all, doesn't give a lot of compliments. He's a very matter-of-factly, logical, pragmatic person, and it's not that he doesn't want to give comments. That's just how he is. He probably doesn't think about it. But he said, your question last week about why people in Northwest Wisconsin, that was a question I asked him on the show, why Northwest Wisconsin should care about the Middle East and foreign policy was one of the best I've ever gotten. And dude, it was huge for me, right? I know it sounds silly, but man, it's just like great. I mean, first of all, I don't remember the question. I literally had to go back and find out what I asked him so I could start asking more of those kinds of questions. But, it's simple stuff. It takes 10 seconds to send a text. Well, maybe for Tom, it took him 30 seconds. But, 10 seconds to send something or say something positive and nice, dude, because words matter. They just do, both positive and negative. So how hard is it? Say something nice to somebody.
Right. That's all. It's the simple things in life that make a big difference, or the little things in life that make a big difference. Maybe that should be the Positive Tuesday with Ben and Fitzy. The little things in life make a big difference. Maybe that's what our slogan on our shirt should say. That'll be the back. The little things in life make a big difference. I don't know. We'll come up with something. I see people want to order shirts on our thing here. So,
all right, well, I'm writing this down. Jeepers, you're gold this morning. This is great. So what's going on since last week or last Tuesday? What's been happening with you? Obviously, you've been a little busy with work stuff, and we'll get to that in a minute. Anything going on with you?
No, I got a haircut.
Let me see. Oh yeah, that's nice.
Did it? My wife did it in the backyard. It's a little cold, but we got her done, so no, that was really it. Had a nice. We were busy this weekend, so. Worked both Saturday and Sunday night on a couple incidents across the county. Other than that, it was a pretty, carefree weekend. Just relaxed and did a few things and shopping, cleaned the house, whatever. Same thing we always do.
Well, going back to the words matter thing, I'll just say this right now because we're going to have Mike Schafer on here in a little bit. Just want to say I have an incredible amount of respect for Mike. He's awesome. What he's done, not just as the CEO at Spooner Health, which, boy, he's gonna have to correct me. It's either just over 20 years or just over 30 years. I can't remember. But what not only has he done for Spooner Health, but also for the community. He's one of those people. He kind of reminds me of you a little bit, Fitzy, where the moment there isn't a moment that's too big for him. Because I think sometimes you see people that are just a little out of their element sometimes, or something big happens, and it's just. They're a little uncomfortable in their own skin. And Mike's certainly not one of those people. He is very confident. He's got a great team. So I just wanted to, 10 seconds, say something nice about someone.
Right.
There you go.
Did you have to do that, or did you, was that out of your heart? A little bit of both.
Yeah, I'll see if Mike wants to say anything about that when he comes on. Yeah. So we usually then kind of go over, or after we kind of chatted for a little bit here, we want to go over anything that either I've done for a story on DrydenWire.com or that you have sent out as press releases or anything going on in Barron County, law enforcement related. I put something up, I don't remember when, a couple days ago. Maybe it was yesterday, from the DOJ, that a Rice Lake man was sentenced to 10 years in prison for possessing child pornography. Obviously, this was the DOJ thing, and I believe it was a Rice Lake case. Are you aware of that, familiar with that, and anything you want to add to that?
Well, I know it was a Rice Lake PD case, and they've done a really good job over the last year of working internet crimes. Their detective, Heather Wolf, has done an unbelievable job, and compliments to her and the people that assist her with these cases. But yeah, we have a child porn case we're working ourselves right now. What I'm telling you is, if you share stuff on the internet, we're going to find it. We're not small town wherever, and we have the technology, we have the staff, we have the expertise to do some of this. We work with people like the DCI and the federal government to do these, and the prison terms are long. And if you're doing these bad things on the internet, we have that ability to come after you and find you, just like we do with drugs or with burglaries or whatever else is going on out there.
Mm.
So realize that we're out there and we're going to come for you if you're out there doing bad stuff, even if it's on the internet and you don't think your victimization of kids is not going to happen on our watch. And Rice Lake PD and the Sheriff's Department do a great job of finding those people.
Yeah, and for all the paranoid conspiracy theory people out there, yeah, there is Big Brother. I mean, at this point, I mean, we're 2020. Do you really think that what you do on the internet and, I'm opening it in incognito mode on Google Chrome? Yeah, dude. You don't understand what that means, actually. It just means it doesn't show up in your search thing, but it's still recorded freaking everywhere.
Right.
I don't know why. I don't know. Criminal.
The cloud is out there, and all your stuff goes into the cloud, and we reach out to the cloud with our search warrants and grab that information. I mean, that's how we explain it to kids and their Snapchats and their everything out there. Is that we explain that, and the cloud is, once it's on the internet, it's out there, and we can get it if we get the right search warrant. So
Jody actually had a great idea for the shirt. I think another saying would be, "Don't sweat the small stuff." That's not too bad. Yeah. Maybe that can go on the back of the shirt or something. That's not too bad.
Yeah.
Love it.
I like that. Yeah. We don't sweat it. I mean, you just got to keep rolling with whatever's going on. I mean, obviously, we've had some things that, obviously the thing with Embrace wasn't real popular, but you know what, we hit it, we talk about it, we do it, and we get through it. And now we're working towards a solution, hopefully here, and we'll continue to work on every issue that happens in Barron County. So
the other thing that you had just sent out, I think yesterday, was a car versus pedestrian accident on 63. It resulted in serious injuries for 2 Shell Lake residents. Any updates that you were aware of there, or any insight on that?
Yeah, we got called to a traffic accident, and not a fatality. It was very serious in the beginning. It looks like both people are going to pull through. They've got a long road of healing ahead of them, but our thoughts and prayers are with them and their family. And the lady that drove the car was an accident. Alcohol was not a factor. Weather may have been a factor. We're still investigating it. It was raining at the time. We don't know exactly what happened, because we haven't talked to the 2 people in the hospital yet to get their side of the story. So that's why it's considered under investigation. But both people, we got updates on Sunday. Both people will pull through, and but they've got some healing to do, and I think some surgeries ahead of them, etc. It was just a bad accident, and we're our thoughts and prayers are out to everybody involved.
Yeah, I actually know the female victim in that Jane. We went to school together. When you grew up in a small town, Shell Lake, we had a graduating class of like 40 people. 35 of the 40, we've all been in school together since kindergarten. So everybody knows everybody. Obviously, again, small town. And so when I saw that, I was like, no. And I haven't talked to her in a couple of years. And boy, it's just sometimes you get a little. Maybe it's important to do this, especially in your line of work, where I either write a criminal complaint story or I post a press release, or there's Polk County, another fatal crash, this or that. You kind of take the you can't think about it too much, right? You can't get emotionally invested in this stuff. It's just facts, just do this and whatever. But when I saw that name, it just kind of took me back a little bit, because there's most of these people that do get in accidents or we do reports on, I don't know who these people are. So there's almost like this little bit of a disconnection there, which I kind of like that, actually. But yeah, that one was, I'm like, oh boy, not Jane. I actually know this person.
And that's what, it's probably a good segue to bring Mike in. But that's the problem with local law enforcement, our local firefighters, our EMS, our ambulance people. They're working on people we know. And it's even more, worse now with COVID and finding people we know that have COVID and working on them in the hospital. And that's why I stress that our volunteer firemen and our ambulance and our EMS people are so critical to us, especially during this COVID time, and we've got to get them a break. And there's only one way to do that, and that's stay home and wash your hands and wear a mask and do all that fun stuff. But I can't compliment our fire department. The Cumberland Fire Department did an unbelievable job for us blocking Highway 63 and rerouting traffic and helping people get around it. at 8 o'clock, or I'm sorry, 6 o'clock or 6:30 on a Saturday night. There's enough traffic out there, and our volunteer firemen, they know these people, they work with them. We had that fatality on the ATV this summer. All those people knew that girl. They had kids that went to school with them. That's what our volunteer fire departments have to deal with, besides helping people. And so it sucks when you know somebody, and it's a little tougher. And but that's just what we do, and that's why we have great volunteer firemen and EMS, and our medical people are top notch.
Wow. You're watching Positive Tuesday with Ben and Fitzy, presented by ICAA. Mike Schafer, Spooner Health CEO, is joining us in, 2 minutes here. This week's ICAA program spotlight features WI Prevail, which is ICAA's Youth Development and Prevention Services program. They partner with communities, families, and youth for their youth development and prevention program, which actually focuses on substance abuse, mental health awareness, youth development. For more information, check out their WI Prevail Facebook page. One more thing I want to get to here is I've been getting so many messages about a death in Barron County, asking what I know. It was this was a death and this was a homicide. Any updates on a homicide? I'm like, I don't know. I mean, I think sometimes people forget that I'm still DrydenWire and you're still a sheriff. Like we do these show and we're friendly, but it's not like I'm just texting saying, "Hey, what's going on?" I'm like, I don't, unless he sends out a press release or something. I have no idea what's going on. So I haven't seen anything yet. Is there anything that you can say about this, or is this something you can't touch right now?
No, it happened in the city of Barron. We are assisting the city of Barron with the case. It is not a homicide. There's no danger to the public, or we would have definitely put that out on Sunday night. There was a death in the city of Barron. We are assisting that. I can't comment on it any further than that. The Barron police chief will. But again, there's no danger to the public. It's not a homicide or anything like that. We did have our command post up there just because of the weather and to work out of. So that's why when we roll that command bus out, it raises awareness and it makes it look like it's a serious thing. We wore some protective equipment going in and out of the house because we didn't exactly know what happened. We were able to determine what happened. The Barron police chief will release that when he needs to, or when he finishes his part of the investigation. But again, no threat to the public, not a homicide. There was a death, but no one's being arrested. No charges are going to be filed or anything like that. So he'll release that more information. Okay. But again, if there would have been a threat, definitely Sunday night, both the Barron police chief and I would have put something out there saying, we're looking for somebody, or we're investigating a homicide or a suspicious death or whatever we put. Yeah. But nothing to worry about. And I get why there were some, people were sending to text and things like that.
Yeah. All right. Anything else you want to discuss before we bring Mike on and talk some COVID?
Just one last thing. Deer hunting is this weekend, opening deer hunting. Yeah. I think we'll probably get into that with Mike a little bit about, just staying away and being with your own family. But just if you are going to go out there hunting, gun safety, we'll be out there in full force. I always work opening morning. I'll be out there opening morning working. I like to go on patrol and just see all these happy young kids going out for the first time, deer hunting, things like that. I've never deer hunted myself. I don't deer hunt, but I've always worked opening morning for the past probably 15, 18 years. And I just enjoy the morning. A lot of happy people out there going to their cabins, going out to their tree stands, and then getting the big deer. So good luck to all the hunters. Stay safe. And healthy
or just stay home. Just kidding.
Well, you can go hunting in the woods. We can't get in the woods if you're with your son or daughter, which you've been with. But stay away from big gatherings and things like that. But I'm sure Mike will ask the people to do the same thing.
You know what? Speaking of which, let's bring him on here. Spooner Health CEO Mike Schafer. Here's your intro, man. I don't know how to get you on here. Hey, there we go. Mike, good morning. How are you, man?
Good morning. Doing great, thanks.
Hey, thanks for
sorry to come rain on your Positive Tuesday parade to talk about something as depressing as COVID, but
well, I mean, I think first of all, Fitzy and I can find a positive in just about everything. So
there's some positives. There are some positives. So
yeah. I would like to get or kind of pick your brain, because Fitzy and I talk about COVID, and as he mentions every show, I'm not the public health officer, I'm not a doctor. It's tough, but he gives us some information, certainly about Barron County. So that's why we both kind of wanted to have you on, because you're very connected in your world. So I'm kind of looking for a snapshot right now. Just give us, where are we right now from not just Spooner Health, but also our area hospitals. What's the status right now?
It's ugly. I mean, to be blunt, it's ugly. Statewide and locally. As you can imagine, I track stuff daily. I'm kind of a data wonk in the first place.
Yeah.
But looking at what's going on in our neck of the woods, we're seeing an increase in COVID every day. We watched for a long time where Washburn County would always sit, out of the 72 counties, we'd be 68, 70th in the number of COVID cases per 100,000. With the last week, we're up around 50. Barron County is one of the worst counties in the state right now for the spread. They're typically top 5 on the daily updates. And what we've seen over the last month, both from just a case standpoint and what's happening to hospitals throughout the state and in Northwest Wisconsin, it's crisis time with COVID. We really need to take this more serious than people have, and make some changes in what we're doing.
And this is something that I think they've all been talking about in the past, right? Take this seriously, take this seriously, take this seriously. So you're just saying the same thing, take it seriously. At what point do you think people are going to take this seriously from what you kind of see? Are people doing more now? Or is this, man, we need more than a politician saying it, or a sheriff, or Ben Dryden saying it? Do we need someone like yourself saying, no kidding?
I think everybody needs to say it. And, I think we were lulled into a little false sense of security. We'd hear about COVID. I mean, we've been preparing. We've had our incident command operating since March. And we just saw ticking along a few COVID cases a day, and I'm speaking specifically in Washburn County. Looking at the numbers, we were 4 or 5 cases, below 4 or 5 cases a day for the longest time. And we knew it was bad. We knew when fall came, things would get worse. We just didn't know how bad and how quickly, I think. We didn't get hit hard the first time around when the eastern part of the state really got slammed back in April. So we didn't experience it. But, one of the positive things is hospitals have been preparing for this since the inception. And one thing I will say, the way I've seen hospital systems and hospitals pull together and work together is unprecedented. The calls we're on with the different systems working together. We got a great workforce in Wisconsin, and not just hospitals, our clinics, our public health departments. They're working hard, but we can only do so much. And we need the help of everybody to do the things that you've been talking on your show, and we've been talking for a long time. The washing the hands, the social distancing, masks are so important, and now the gatherings. We're seeing not just we're seeing family gatherings of 2 or 3 families that are causing outbreaks. Churches causing outbreaks as well. It's serious situation right now.
Yeah, and I think I would agree with you, Mike. And I think people are starting to finally catch on. I think we've seen some things change this week already. I think there's a question: do you think schools are going to go online? I think a lot of schools are going there. I know my kids go to the Rice Lake District. I believe they're going to go to an online school for a week or 2 here to help us slow the spread. I don't think schools have caused a ton of the issues, but it's the staffing issue. It's really where schools are. We're not seeing so much of the spread, but it's a staffing issue both on my end, from law enforcement, your end, from the hospital, I'm sure, and our teachers are having a tough time, keeping staff and that don't have COVID or aren't a close contact, et cetera, et cetera. So I think staffing is really the issue on our 3 ends, and I think that's where people, just because schools go online doesn't mean there was a big, massive spread of COVID in the school. It means we had a staffing issue.
I would agree. And what I'm hearing, we've been fortunate here so far at Spooner Health. We haven't seen a lot of staff that have contracted COVID. We've had a number of staff out due to close contacts, which I think is happening. But I know another area hospital that was on divert for days. And it wasn't because they don't have the bed available.
I'm sorry to interrupt, but divert?
That means ambulances are diverted to other hospitals. They're not going to admit inpatients if they can help it, simply because they don't have the staff.
Divert.
It,
So,
it happens.
yeah. So you just go to the what? I'm assuming like the next closest hospital. Is that usually the case, or from your
Yes.
understanding, or they just go I don't know next county? So it's just like a 10 or I don't know 15-minute drive.
Yeah, it depends. If we're on divert, which our ER has been on divert a couple times recently because we've been very full and we can't take care of the patients. Walk-ins, of course, get seen, but if an ambulance comes, we'll divert them to the Shell Lake Hospital, to Rice Lake, to Hayward, depending on what direction they're coming from. We've been fortunate that our situations have been just that. It's been a one-time deal, but other hospitals haven't been so fortunate. And we're really struggling to get patients that need a higher level of care to another facility because hospitals are full. I mean, just to give you an idea, in Northwest Wisconsin, as of September 17th, so looking back 2 months ago, there were 13 patients hospitalized for COVID in Northwest Wisconsin. And that's really looking at the I-94 corridor north up here.
Okay.
224 yesterday. There were only 88 beds available in all of Northwest Wisconsin of any type of bed.
Yesterday, 88?
Yesterday,
Okay.
88. And it's been worse. It's been down in the 50s. So we're seeing a lot of sick patients who didn't get care early on in COVID. Your chronic patients who, because hospitals shut down certain services because we had to and we didn't know what we were dealing with, and then people didn't want to come see the doctor. They were worried about catching COVID in hospitals and clinics. And I will tell you, we're still the safest place to be because of the precautions we take. We've just seen those beds. We had a day last week where there were only 2 ICU beds available in all of Northwest Wisconsin. As of yesterday, it appeared to be 8. So, I mean, hospitals are getting overwhelmed. I think we've had 13 hospitals at one point that med-surg beds were at capacity out of 26. It's real.
Yeah.
Patients are in hospitals. Yeah.
So when it comes to ICU, intensive care unit, right? That's what I'm assuming.
Yep.
This is where, like, how does a person that has COVID, like anyone that has COVID goes right to that, or ones that really, really need it? How do they end up in ICU? And then to kind of put this in a bigger context, if they're all full, I'm sure other people need ICU.
Yeah. One of the things that hospitals are doing, the larger hospitals that do a lot of elective overnight surgeries, is they're stopping to do elective overnight procedures again to keep beds available. Hospitals like ours and critical access hospitals, the smaller hospitals, we don't have licensed ICU beds. Rice Lake Hospital, Marshfield Hospital, Rice Lake does have licensed ICU beds. So we see COVID patients in our hospital. We currently have 2. We've been fortunate to never have more than 2 at a time, but I know one rural hospital that had 13 at one point. So we see them. There's a lot of things we can treat with knowing what we know about COVID now. But when those patients need a higher level of care, then we look to transfer them to an ICU. And now, keep in mind, I'm not a medical person, so I'm talking what I know. But so I can think of one patient we had here that started to deteriorate, needed an ICU bed. Fortunately, we're able to get them up to Duluth right away. But right now, if you want to send a patient to an ICU in the Twin Cities, there's actually basically a hotline you call, and they help you find the bed versus our usual practice of calling different hospitals we might have relationships with. So they recognize the problem in Minnesota, and a couple weeks ago, they appeared to be 5 weeks behind us in number of cases. They've caught up. So it's not just us facing it.
Mm.
Yeah, and I think that's what the other point is. Everybody thinks COVID, but then you have an accident like we had Saturday night, and we got to have places for those people to take these people to go. And so it's not just COVID patients looking for beds. It's then we have accidents and heart attacks and other things that go on that some people forget about, because if it doesn't affect me, I don't have to worry about it. I don't have COVID, so I don't have to worry about all these hospital beds. Yeah. But it's what if I have a car accident? What if my son or daughter has a car accident? So it's the things like that. That's why we're saying stay home. I saw a funny thing, and we try to make this positive. Zoom giving is better than an ICU Christmas. Well, it's funny, it's not, but it's the idea that that's how serious this is. It's like I'd rather Zoom with you over Thanksgiving than have to stand outside the hospital because there's no visitors in a hospital. So if somebody goes into an ICU or has a heart attack or whatever. These people are having babies and they can only have maybe one person in there while they're delivering the baby. And instead of a whole family, having this joyous moment, we've got to get control of this. And I know people say we should mask mandate, and, there's not a law out there, so I can't do a lot of things as a law enforcement officer. And the Democrats and Republicans need to figure out a plan, whatever that is. But we can take care of our own in Northwest Wisconsin, and that's what we do good here. So continue to do what Mike asked you to do and what our public health people asked you to do. And that's just, we got to just lay low this Thanksgiving and just take it easy and make sure our hunting cabins are just our immediate family and things like that. And we'll be back at this next summer, having a fun summer on our lakes and boats and things like that.
That'd be nice. I'm glad you brought that up, because that was kind of where I wanted to go with this a little bit, was if the hospitals are getting full and all that stuff, and people are trying to understand it. And I think there was a question on here that we can certainly put up from I can't read it from here. But the ones that are going, who cares about COVID, right? Don't care. Which, you know what, that's your business. If you're really that way, that's whatever. But is there an impact on the community in other ways that maybe they should be paying attention to this? And I think, Chris, you just alluded to that with so if these beds get full, then that means if somebody's in an accident, a family member of yours is in an accident, now they don't have potentially a place to go locally. They have to go somewhere else. And let's face it, the further you have to go, the less likely, or I would just assume, the odds don't go up of you surviving if you're not in one of these places.
That's so true, and I'm glad you brought that up, Chris, because I think that's something people don't think about. I hear people, I read on social media, well, it's not COVID that's filling up hospitals. It's everything else. Well, I was hearing one of the Duluth hospitals was 80% full before COVID came, and a lot of it is the results of things that weren't done during the early days of COVID. So yeah, hospitals may be 80% full with everything else, but COVID is definitely what's pushing hospitals over the edge. It's what's overwhelming them. And a lot of the hospitals, as we talked earlier, it's not necessarily bed capacity either. I talked a lot about bed capacity, but when I talked to my colleagues in the eastern part of the state, where Green Bay was hit hard for a second time, it's staff. It's between the staff that are quarantined because of close contact and everything else. They have a hard time staffing. So what's happening is hospitals will close down certain units. They'll quit doing surgicals, as I mentioned, on overnight patients. If we were to get overwhelmed with staff being off of work, we would have to close our surgery department, redeploy those nurses other places. Well, those are patients then who aren't getting care now, things like colonoscopies and things like that are diagnostic, that get put off and potentially could cause longer-term harm to patients. So we don't want to do that. We want to keep our staff safe. We preach to our staff, be smart, do the things right. I think it's important to note, this just isn't hospitals and law enforcement and first responders talking. I looked at the Stop the Spread Coalition, which a hospital association really kind of put together. The Green Bay Packers are part of it. The Grocers Association, the Bankers Association, Wisconsin Restaurant Association. I mean, we have an unprecedented number of interest groups working together to help stop the spread, recognizing that, restaurants of all people have suffered through that, and that's understandable. But they understand that's going to continue if we don't get this under control. Right. So, again, the masking, it's too bad it's gotten political. It shouldn't be.
Yeah.
Science supports masking. Yeah. And it's what we do for our fellow human beings.
Yeah, that's just it. Here, I want to ask you this question here. I put up on the screen. I'm sure you can see it there, Mike. Not to mention seriousness. I've read several articles that say normal hospital capacity is 85%. Can you address whether this is true for hospitals in Northwest Wisconsin?
No, it's not true for most hospitals in Northwest Wisconsin. I would say closer to 50% might be there, but some of your larger hospitals that the Eau Claire area, Duluth area, that might be true. I would say I used the figure 80% a little bit earlier. That's what I was hearing pre-COVID. 80% full, but a lot of that was due to what happened in the early days of COVID. Sure. Hospitals are a business. We have a bottom line that we have to meet. We're not going to staff and have a bunch of beds. If as a hospital here, we staff 12 beds inpatient. We're not going to staff for 20, if our patient load isn't going to dictate it. So when something like this happens, we're ready for surges. I mean, we could go from 1 patient today to 12 tomorrow in a normal circumstance, and we're ready for that. It's if we get 16 or 20 that we have to put our crisis staffing and our surge plans in place.
Did you see yesterday, I put up in the morning, and it was all over the news yesterday anyway, I think it was Moderna came out with a vaccine. I think it was in stage 3 trial, was at 94.9, about 95%. Did you see that? Is that something that is, wow, that's great news, or it's, yeah, that's just another whatever, and who really cares, and this probably not going to make a difference? Is that a big deal?
Well, on your positive Tuesday, that is the most positive news that we could have.
All
Yes,
right.
very good, Ben. Last week, Pfizer came out, and Pfizer's over 90%. That was great news because everyone was waiting to see what's going to happen. The experts were predicting a vaccine coming, that third phase trials would be about where they're at, but they were thinking 60 to 70% effectiveness of vaccine. So Pfizer comes out at 90%. One of the issues with the Pfizer vaccine is it has to be stored at like 70 below zero. So from a standpoint,
70 below. Do you have a facility at your hospital? Do hospitals?
Well,
do you have something like that?
There's places throughout the state that they've identified for storage, and they can stay for so many days on dry ice. So there are ways to do it, but I think they're going to be shipping in lots of 900. So you have to figure out how to use them quick. The Moderna one, 95% almost. To have a second vaccine come out with that type of results shows that the Pfizer isn't a one-off, that it's going to work. That has to be refrigerated, is my understanding, so it'll be much more friendly. But we're really looking at having frontline healthcare workers potentially, they're saying by late December, early January, being able to vaccinate frontline healthcare workers. I think that's going to go for your ambulance crews, your law enforcement. I mean, and your high risk people, your nursing home residents. There's a conference call starting this morning, I know at the state level, to talk about the distribution. So, I mean, that's the best news we could have got. If you would have told me we were going to have a vaccine at 60 to 70% effectiveness that would be available for first responders, for frontline healthcare workers by the first of the year, I'd have been very happy. But to hear it's above 90, and there's a lot of talk about the trials are being rushed. They're following very safe scientific practices. Every expert I hear says they will get this vaccine. It's just when you go 24/7 towards a vaccine like they've done here, I mean, yeah, it is a vaccine in record time, but it's exciting news.
When are they anticipating having this potentially given to or available for our frontline workers?
Yes, they're talking late December, early January.
Hey, Fitz, it is good news.
Yeah, we had a call yesterday, and we were in the planning stages with our emergency management of all of our counties to work on this and distribution, mass distribution. But yeah, it's going to go to our healthcare facilities, our nursing homes. Our nursing home workers are someone we don't always talk about and think about, but they're struggling right now with our nursing staff. So we want to give a shout out to them and just tell them, keep your heads up, hold high. People did that for us during the Claus case for 88 days. They sent us letters. They sent us food. They sent us notes. They high-fived us. You know what? We need that same thing for our healthcare workers, our nursing home workers right now. So next week when you're off and your kids are home and you want to do something that's thankful, color a bunch of pictures, say we're thinking about you, and send them to our hospitals and our nursing homes. And Mike will put them up, and their nursing home people will put them up. And I'm telling you, when people walk by them, they're going to look at them and smile, and that's what you want. So you want to do something that doesn't cost you a thing, draw a picture, just do something nice for our hospitals, our nurses, and our nursing home people, and let's go make a difference. That's what it's about.
I agree. There's a question I just put up there from Mary Hills. When is the public get the shot? Pardon me. Was there any information about that, or is it, right now, let's just get the frontline workers, and we'll figure the rest out later?
From what I'm hearing, they're talking probably April or so for mass distribution. It's both the vaccines are 2-shot vaccines, so you have to get dual shots, so they have to produce that way. But the government's taken an unprecedented step through Operation Warp Speed. They have committed to purchasing tens of millions of these. The companies are making, my understanding, the vaccine as we speak, so that the minute they get the emergency use authorization from the federal government or from the FDA, they can be shipping like within a day or two.
Sure.
I mean, that's their goal. So unprecedented. So.
All right. Do you have any concerns? Fitzy brought this up a little bit earlier. We're talking about hunting. Do you have any concerns about COVID increases in hunting? And if you do, I'm sure it's not like, hey, people don't, you're not like anti-people hunting, but just from a Spooner Health CEO standpoint, concerns about hunting? Absolutely.
Any gathering of people that don't live together. There's a Georgia Tech put out a predictor model based on statistics, and I just ran it yesterday. Any gathering in Washburn County of 15 people right now, there's a 44% chance that one of those 15 have COVID. So when you bring people together in hunting camps, and I realize it's a tradition that people live for, you wait all year for it, but anytime you bring people indoors in close settings that don't live together, you are increasing the risk. So when I hear people talk about nationally about Thanksgiving and Christmas, I grimace a little more, because Thanksgiving in Northwest Wisconsin also means deer hunting camps. And if there's one year you're not going to go to camp, you're going to do something different, this would be the year. And most people who get COVID don't end up hospitalized. In Wisconsin, only 4.7% of those who catch COVID are hospitalized. But some of those that are hospitalized get it very bad, very serious, and people die from it. Yeah. I mean, it is a real bad virus to catch.
Yeah, Fitzy, here, I'm sure maybe you haven't thought about this, and maybe I'm just getting way too down the theory rabbit hole. But if there are people, like we've canceled Thanksgiving, I think we're actually, like our family, we're not canceling Thanksgiving. We're still doing Thanksgiving. We're just not having 25 people at my mom and dad's house. And we're actually probably going to do the same thing. We've pretty much already called it, because Christmas is like 38 days away. So we pretty much already decided maybe not even Christmas. But if there are people out there that have taken or thinking the same way that Mike is kind of thinking right now, that maybe this is the year to not go hunting, well, that also means less deer are being killed. Could this be a situation where, look out like in a month from now, because deer are going to be everywhere because nobody's killing them?
I think you're thinking way too deep. But right. If the DNR decides that they could actually extend hunting season, they can have a doe season mid-year. I mean, that's the neat part about COVID. It brought a lot of people together that haven't been brought together, whether it's local hospitals or whether it's whoever. Yep. We've done a lot of things together that we always haven't thought about. Yeah. My phone's ringing, sorry. And that's what's really been cool about COVID. But this is not the year of getting what you want. It's the year of appreciating what you have. Yeah. And that's what we need to think about this week. If for Christmas, if we don't have any COVID patients in the hospital, that'd be the greatest gift that we can give to our healthcare workers. So let's work towards that. Let's have a goal in mind, and let's push for 0 COVID cases in the hospital by Christmas.
Love it. Love it.
Yeah, let's do it.
All right.
As far as Ben, I just want to clarify, as far as deer hunting goes, deer hunting is great. Be out in the woods, do that. It's the mass gatherings, the camps, those are where the danger runs.
Okay, that's true.
Go out and hunt and enjoy yourself. I mean, we need our mental health taken care of too, and I know people live for that week. So
I like Fitzy, I've never been hunting in my life, so I don't know anything about it.
I only hunt bad guys, so but you can do it with your immediate family, the son and daughter that you live with every day. You can still take your son or daughter hunting. I think Mike makes a good point to that. So I just appreciate Mike, your staff, everything you do. I just thank you for what you're doing and what your staff is doing. And I know as leaders, it's our staff that does it. We just get the front lines of it, but I appreciate you coming on and your honesty and answering some of these people's questions, and it makes a difference, and I appreciate it, and thank your staff for us.
Yeah,
well, I appreciate your having me and the opportunity to talk about it, and hope I didn't drag down Positive Tuesday. Glad we ended up talking about the vaccine.
Yeah,
that is very positive.
You betcha. I mean, that's huge, and I think a lot of people weren't really paying attention, because it's just another thing where you just like, a vaccine, this, that, whatever. But you really should be paying attention to this one, because this is going to be huge when and if it comes to fruition. And as you had just mentioned, it could be a lot sooner than you think. So,
and getting the word out of its safety. I mean, there's been a lot of politicization of the vaccine as well. The FDA is not going to approve something that's not safe. So
awesome. Special thank you to Spooner Health CEO Mike Schafer for jumping on with us for a chat today. Fitzy, is there anything else you wanted to add?
I have one more thing, Ben.
Oh, sure.
I believe you had something else you were supposed to say to me.
I said it.
But before you do, just give me a second.
I think Ben lost a bet. I'm just guessing.
Oh, man.
I wanted to be appropriately prepared for this.
Yes, I thought I already did at the beginning of the show. But yes, Mike is, I just want to let everybody know that Mike is awesome. especially when it comes to picking his favorite football team over my favorite football team, the Bears, when it comes to, Monday Night Football games. Mike, you are an amazing man. You are brilliant. You're a genius. I bow down to you. You can't pick elections very well because I won that one, but you are great at picking the Vikings-Bears game. You're awesome.
Well, I am just glad that I didn't have to say the same thing about you, Ben, and I won the bet. So, anyway.
We would have lost connection, Mike. Don't worry. We'd have just
Fitzy, anything you want to add or at the end here? Anything last words, comments?
No, just keep doing what we're doing. Let's go make a difference. Send some nice words out to somebody and let's make a difference in the world.
I agree. For Sheriff Fitzgerald, I'm Ben Dryden, and you've been watching Positive Tuesday with Ben and Fitzy, presented by ICAA. Again, thank you, Spooner Health CEO Mike Schafer, for jumping on. This week's ICAA program spotlight features WI Prevail, ICAA's Youth Development and Prevention Services Program, which uses a global approach that helps support youth and positively impacts their environment. Don't forget, as soon as we're finished here, go on Facebook to just search WI Prevail and make sure that you like that page. More information is on there. So until next time, stay safe, keep your social distance, and as always, have a blessed day.